Pathophysiology of Pneumonia. It starts with a cough, maybe a fever, signs so subtle, they're often dismissed. But beneath the surface, your lungs may be fighting a silent war. Pneumonia, a common yet potentially deadly infection, triggers a complex physiological response that transforms the very structure and function of your respiratory system. Understanding how the lungs react is not just essential for medical professionals, it's crucial for anyone who values their health. Pneumonia occurs when pathogens, commonly bacteria, viruses, or fungi, invade the alveoli, the tiny air sacs responsible for gas exchange. The lungs, usually sterile, respond with inflammation and immune defense mechanisms that, while protective, may also compromise respiratory efficiency. The first step is pathogen recognition by alveolar macrophages, which release cytokines to recruit neutrophils and other immune cells. This cascade initiates vasodilation and increased capillary permeability, allowing immune cells to reach the infected site. As fluid and immune cells flood the alveoli, gas exchange becomes impaired. Oxygen struggles to diffuse across the inflamed alveolar capillary membrane, leading to hypoxemia. Clinically, this manifests as shortness of breath, chest pain, and increased respiratory rate. The once spongy lung tissue becomes dense and consolidated, a condition easily seen on chest X-rays and known as pulmonary consolidation. In bacterial pneumonia, the inflammatory response can escalate rapidly. Neutrophils engulf bacteria, releasing enzymes that can damage both pathogens and healthy tissue. This explains why, despite being a defensive measure, the immune response may worsen lung injury. In viral pneumonia, cytopathic effects of the virus itself, along with a dysregulated immune response, further injure the epithelium, sometimes leading to acute respiratory distress syndrome, ARDS. The lungs also attempt to clear the infection through mucus production and coughing, natural reflexes aimed at expelling harmful agents. However, excessive mucus and impaired ciliary function can lead to airway obstruction, exacerbating the respiratory compromise. The lymphatic system plays a role in drainage, but when overwhelmed, pleural effusions may develop, fluid accumulation around the lungs that further restricts expansion. Recovery hinges on early detection and intervention. Antibiotics, antivirals, or antifungals target the root cause, while supportive care, oxygen therapy, hydration, rest, helps the lungs heal. In vulnerable populations like the elderly, infants, or immunocompromised individuals, complications can be severe or fatal. Understanding the pathophysiology of pneumonia empowers us to act sooner and recover faster. Your lungs are your lifeline. Do you really know what happens when they're under attack?